but in part, the realities of it is I have support from the governor to do my job, and I have the best Department of Corrections in the nation. Thank you.
Thank you, Director. Are there any other questions for Director Daniels at this time?
Justice Hardesty, Todd Story with the ACLU again. I had a follow-up question just based on some of the comments that Ms. Mull made, because at the ACLU we've gotten conflicting information from literally hundreds of family members and inmates reaching out to us saying that they do not feel safe, that they are not able to get the materials that are said to have been given to inmates in order for them to wash and clean their facilities. And so we've gotten different information directly from those inmates or their family members relaying that information to us. So if there's any way that we can clarify that, that would be helpful. And then another follow-up question to my initial line of questioning is that all of the folks that have been tested, according to Director Daniels' first statement, the 39 individuals, are those self-reporting, and has NDOC actually done any systematic screening of inmates, either using a temperature technique or some other way that they would be able to screen the populations in these facilities, or is it just strictly based on self-reporting?
This is Michael Minev, Medical Director, NDOC. Can you repeat your question again, please?
Yeah, so you've conducted 39, I think you said 39 tests so far, and I'm curious, is that a result of self-reporting only, or are you doing systematic screening of the population?
This is Michael Minev, Medical Director, NDOC, for the record. This is a combination of self-reporting from inmates as well as our medical staff at our facilities, paying very close attention to any type of medical complaints that might be suspicious for COVID-19. I have instructed all of our providers in all of our facilities to have a very low threshold for any COVID-like type symptoms. Obviously, it's becoming broader and broader by the day. We have instituted screening of at least one of our facilities in which there were a suspicion of maybe more individuals that might have COVID-like symptoms. So what we did was we instituted a temperature checks for the entire facility on a daily basis, and that is currently ongoing.
Is that only one facility?
That's only one facility at this time, correct.
And is there a reason to not do more system-wide temperature screening?
I'm basing, again, Michael Minev, Medical Director, NDOC. I'm basing this, screening of temperatures at that particular facility on a daily basis based on the number of cases that we had at that facility. Our other facilities have not had, in my mind, the clinical suspicion to do the pan screening like that particular facility.
We've seen other facilities across the country that are doing system-wide screening. And so if there's any way that could be practiced here in Nevada, I think that would certainly give us a lot more understanding as to what is actually happening within the populations that we're housing in our facilities. And then just as a follow-up, we also saw a news report this week that there's a specific situation at Lovelock with regard to those youth who are incarcerated there, and the infirmary being the place that they're being housed, and thereby subsequently making that space unavailable should there be any medical outbreak at Lovelock specifically. Can you speak to that, please?
This is Michael Minev, Medical Director, NDOC. Lovelock does have that situation based on the youth offenders. However, they do have a part of the gym at the gym. Yeah. The gym at Lovelock has the capability of being converted into a quarantine unit, and we do have the necessary equipment to create a quarantine unit at Lovelock that would afford the youth offenders the protections that they need.
Well, I don't want to get in a debate about that, but it seems that the PREA requirements are already violated based on the fact that the disclosure was that it's only a drape or a curtain that's separating the youth from the adults.
This is Director Daniels for the record. We are a professional corrections agency, and we work hard at keeping the public, staff, and inmates safe. Our agency fields complaints regularly, and we address them with that same regularity. Do we have a perfect organization? No. But do we care? Are we relevant? And do we execute our public duties in the best way possible? Absolutely. Thank you.
Are there any other questions for Director Daniels or his staff?
I have a question. It's kind of related to something that was discussed at the last meeting.
For the record, Assemblywoman Nguyen is speaking.
That's correct, Your Honor. Sorry about that. You had mentioned, or someone had mentioned, that there were about 300, and maybe this was the Department of Parole and Probation, but someone had mentioned that there were about 350 plus people that had been granted parole already. And I was wondering, you've been great about providing updates and clarifying and correcting some of the other representations from the last meeting, and I know a lot has changed in the last 2 weeks. So I was wondering if you had any kind of updates to whether or not we were able to process some of those people that have already been granted parole. They were just either waiting on placement or plans or any of that.
Assemblywoman, I was going to have Chief Carpenter provide that as part of her report.
Okay, then I'll just hold off on that. I saw her shaking her head over here, so I will wait.
Well, unless Director Daniels wants to weigh in, but I was going to defer that subject to Chief Carpenter.
This is Director Daniels for the record. I will defer to Chief Carpenter. Thank you.
Okay.
And then just my follow-up. I appreciate that the director was so receptive in opening up the prison. Just for the record, I would be happy to go and visit in a normal capacity, but in light of the governor's order, in light of the fact that I have vulnerable individuals that are in my home that I wanted to protect, that is the reason that I chose not to participate. If there is ever, and I put this in an email to the director of the Sentencing Commission, that if there's ever a opportunity for something to be done remotely so we can participate in those town hall meetings with the inmates where we can at least observe what's going on, I would greatly appreciate that, as well as I know there are other members of this commission that didn't feel safe and comfortable with their health and the health of their family members attending that type of tour at this time. So I appreciate you being so receptive and opening that up, and I'm glad that other people were able to. I just personally did not feel comfortable. What I can tell you is I also receive a lot of legislative email from prisoners that is contrary to some of the representations and the experiences of Ms. Mull and Mr. Ponder. So I would just like to have an open dialogue about that. And I know other legislators, in talking with them, also receive legislative email from individuals that are incarcerated that kind of echo some of the comments that Mr. Story had indicated about not having access to that, not having their medical concerns. And I'm glad that we're receptive to, I know this is an ever-changing dynamic, like with the CDC, bumping up the symptoms that we need to look at. I'm glad to hear that the prison is also receptive into incorporating those changes as they develop. So thank you.
Any other questions for Director Daniels?
This is John Harris Scott. I have just a couple. Following up on Mr. Hicks's questions, could the director or his staff provide to the commission a list of at-risk people that are incarcerated currently at the prison? Our Washoe County Sheriff's Department was able to do that. Then I also have a question of Director Daniels. He said that they're practicing social distancing for the most part. If you could elaborate on that.
This is Director Daniels for the record. In most of our housing units, the inmates are assigned to cells, typically 2 to a cell. However, when they're outside of their cells, where the social distancing comes in is when they're out and they can eat and use the telephones and use the showers that they typically, we've shared with them what's going on in society with the social distancing, and they typically social distance themselves. So that's what I meant for the most part. Now, I'm certainly not referring to them inside of their cells, but so my response was based on when they're outside of their cells, in their pods, in their smaller groups of individuals, they're able to keep some distance amongst one another.
Thank you for that. And maybe I misunderstood the last meeting. Don't you have most of the inmates on lockdown where it's 23 hours in their cell and only 1 hour out?
This is Director Daniels for the record. In many respects, at certain facilities, for instance, at Ely State Prison, those inmates spend the majority of their time inside cells, depending on the housing unit. In my other housing units, the inmates spend much more time in my other facilities, much more time outside of their cells. But that time is limited.
Yeah. Director, I'm not trying to argue with you. I just distinctly, I think, recall from the last meeting, I think you said that virtually the entire prison system was on a 23 hours in cell, 1 hour out, so that you could control groupings. But I guess what that means is that inmates are 23 hours a day unable to practice social distancing with their cellmates.
Right. Well, once again,
Director
Daniels, this is for the record. Here's the way that it works. I believe at our last meeting, I believe High Desert State Prison was referenced, and at that particular time, High Desert State Prison was on lockdown. We also have other issues that go on. For instance, programming and religious services, which have been modified, and we don't have that type of programming available, or it's greatly limited or reduced, and those inmates spend more time in the cell. However, I'm not going to go facility for facility and circumstance for circumstance. I provided you with a generalized answer, trying to give you information that was requested as with anyone else. We had an opportunity. We invited everyone, and there was opportunity to come out and see for yourself and ask questions. I have wardens at each of my facilities that do a great job, and they have to deal with the issues that are in front of them on a daily basis, and they have to make adjustments based on their security concerns and other concerns at their facilities. Nonetheless, once again, I stand by my statement. We do a very, very good job and under very, very difficult circumstances. For me to sit here and parse what happens at every facility at every single time would not be appropriate, and I would never be able to get that right, as the wardens have to do what they have to do to ensure the safety of their facilities. Thank you.
Yeah, thank you. This is John Aristota again. May I, Justice Hardesty?
Yeah, go ahead and finish up your questions.
Thank you. Director Daniels, I too appreciate all that you've done. You're aware that Sheriff Lombardo sought a 10% depopulation of the Clark County Jail in order to practice better social distancing? Are you aware of that?
I'm sorry, repeat your question.
Are you aware that Sheriff Lombardo from Clark County sought a 10% depopulation of his jail in order to practice better social distancing?
I believe I saw a public announcement of that nature.
Okay. And then also up here in Washoe County, we have not had any positive tests at our Washoe County Jail. However, one of the captains who's in charge of detention said it would be naive to think that COVID-19 that they would escape without having some type of positives at the jail. Would that list, if you know, the list of the people incarcerated that fall under the CDC guidelines, would that if that was depopulated by at-risk people, would that give you better ability to socially distance?
My response is this. I do the best we can with our circumstances, and to date, we have 0 positive COVID-19 cases in our inmate population. I will not continue to go back and forth on what others are doing. Our circumstances are ours, and we're doing our best to manage it. I would hope that you would understand that, but thank you for your recommendation.
Thank you. I have nothing further.
Any other questions for Director Daniels at this time?
Hi, this is Emily Salisbury. Thanks so much. Director Daniels, I do want to thank you for the opportunity to enter the institution. I myself was out of town last week, so I was unable to attend. I would have been there, but I did have to go out of town to seek housing and housing transition. I also want to thank your staff for the incredibly difficult, challenging, hard work that they're doing every single day. As I've said before, I've met many of them in several of your institutions, and I have no doubt that they are doing their absolute level best under the circumstances that we are in. I do have some questions in particular, first of all, just to ask a little bit about what's been going on in other institutions. And I know you don't want to keep coming back to this, but I do need to kind of point out that 8 out of the 10 highest clusters of COVID-19 are in detention facilities and jails. There's been a number of institutions that have started to test incarcerated people who are asymptomatic and are finding very, very high rates of inmates who are testing positive, including one prison in North Carolina that after they started massively testing in one of their facilities, 90% of the inmates who were tested were asymptomatic in terms of testing positive. 90% who tested positive were asymptomatic. So the Federal Bureau of Prisons is also starting to open this up and test widely for asymptomatic inmates in order to contain the spread. We've got, of course, a number of public health officials, including one at Johns Hopkins Bloomberg School of Public Health, Leonard Rubenstein, who's quoted in the USA Today saying, quote, unless you do universal testing in all environments, risk of spread is enormous. If you are waiting for symptoms to emerge before you do the testing, you are getting a false picture of what is going on. It's too late. End of quote. I wonder if both you and Dr. Menev could speak to whether or not you feel like NDOC needs to be doing more wide testing, particularly given these latest statistics and the latest news coming out about the number of people who are incarcerated who are asymptomatic and apparently continuing to spread it not only amongst themselves, but with staff and then potentially staff in the public. Thank you.
This is Director Daniels. For the record, thank you, Dr. Salisbury, for the information you've provided. The first comment is related to your data on jails and detention centers in the clustering. We don't have jails or detention centers. We run prisons. So we don't have and the reason I'm bringing that up is we don't have the same transiency, and we have much more controlled environments, and we have large medical staffs at each of these facilities. So that would be somewhat different in terms of how we would view it. In terms of the medical aspect of it and in terms of testing, I'm going to turn this over to my medical director, Dr. Menev.
This is Michael Menev, Medical Director, NDOC, for the record. I have been in very close contact with Dr. Azam, the Chief Medical Officer, DHHS of State of Nevada, almost on a weekly basis. Definitely considering every possible means to keep our staff and our inmates safe at all times. Is asymptomatic testing on the table? Absolutely. But I think at this point in time, I don't think it is necessary. However, that can change at any time. I definitely am open to any possibilities on the table, and I continue to gain insight from obviously the CDC, but also from continued discussions with the Chief Medical Officer, Dr. Azam. So again, we are trying everything we possibly can to keep our inmates and staff safe at the NDOC, and I definitely will keep those under consideration.
Okay, so what I hear you saying, Dr. Menev, is that you're open to entertaining a possibility of more widely testing, particularly those inmates who are asymptomatic. Is that correct?
Correct. This is Michael Menev, Medical Director, NDOC, for the record. One example of a small cohort of inmates that we have tested that were asymptomatic were all our pregnant inmates at Florence McClure, and that was just done within the last 2 weeks. And we were very lucky that they were all negative. So obviously the testing issue is a hot topic right now, the lack of tests out in the community as well as throughout the country. But if tests become more available, I am definitely open to opening the testing of asymptomatic individuals. But at this time, tests are obviously a very hot commodity. Dr. Panduri at the state lab, in conjunction with Dr. Azam, are doing everything they can to not only provide extra tests for our inmates, but also for the state of Nevada. So it is it's a constant battle, and we're keeping up on it every single day. But you know, again, I'm trying to do my very best here to keep our staff and our inmates safe based on their recommendations.
Thank you for that. And then just as a follow-up, so 2 of the top clusters are actually prisons, Director Daniels. So I may have misspoke and said detention centers. Of course, prisons are different than detention centers and certainly different from jails. But, you know, a couple of prisons actually in Ohio, one has, I believe, the number of positive cases is 80% of the inmate population. So that's a prison institution. That is one that is not a jail. So I just, you know, again, am curious to know your take on whether you feel like more widespread testing of asymptomatic individuals inside the prison system need to be tested.
This is Michael Menev, Medical Director for the NDOC. Do you have a timeline of when preventive measures were instituted at the Ohio prisons that you're referencing?
I can find out. I can get back to you offline or as part of this meeting in the next meeting. Of course, that's not until July, but I can find out because I'm in quite close communication with one of the medical correctional health experts, Dr. Megan Novisky, in terms of what they've been able to do. And it is entirely possible, I'm glad you bring up that point, that there may have been less precautions taken early on. So I absolutely hear your point on that. I do have a number of other questions that I would like to ask just in terms of, you know, whether, like, can you talk to me about how the grievance process is occurring inside your institutions for staff who might have grievances in terms of what they may be seeing in terms of the precautions that are being taken, if they're not seeing precautions being taken? Like, what capacity do your staff have to bring forth grievances or complaints up the chain?
This is Director Daniels for the record. Our staff are keenly aware of how to utilize their chain of command to ascertain information or make complaints and so on. We also have an Inspector General's office that also serves for an additional outlet. And there's also the Human Resources Department, which would serve as another way of finding out facts or making complaints or sharing what they believe to be either inappropriate behavior or a lack of whatever you want to call it. But so our staff are very well of it. Our staff, the majority of them are sworn, and they certainly know the chain of command and how to get things done. They perceive that something isn't working out right. Thank
you. And then just one last question for you. Is NDOC still transferring incarcerated people from institution to institution? Is that still occurring, like in terms of what's the protocol? Can you just tell me again the protocol, if that's still occurring? Are people being quarantined? How long are they being quarantined if they are being transferred from facility to facility?
This is Michael Mitta, Medical Director, NDOC, for the record. I have sent out communications to all facilities, wardens, assistant wardens, as well as all the medical staff to notify me if there is any transfer that is needed. Those transfers are being carefully screened. Again, we are not only screening in terms of cardinal symptoms, but any type of suspicion for COVID-19 infection. Only in emergent situations will inmates be transferred, but we definitely try to do a very thorough medical assessment of the inmate before their transfer, if they need to be transferred.
Okay, so all right, that's helpful. Thank you. No further questions. Thank you so much.
All right, any additional questions from commissioners of Director Daniels?
I'm so sorry. Just one follow-up question. You had mentioned that you tested all the pregnant women at Florence McClure. Of those 39 tests that you had tested, how many of those were the pregnant women that you tested?
This is Michael Mitta, Medical Director, NDOC, for the record. Those included 9 pregnant females from Florence McClure.
Thank you.
Any other questions for the director? All right. Let's move on to Chief Carpenter and the Division of Parole and Probation. There was a specific request, Chief, if you could share with the commission sort of the category or group of folks in the 398 that, at least as of April 13th, you mentioned had been granted parole but not released. And I think it would be helpful for the commission as well as the public who are listening in to get a sense of some of the limitations or obstructions or whatever you want to characterize them to releasing some of those people, and then maybe any updates you've had developed with respect to added numbers and maybe even those who've been released, if you wouldn't mind.
Hi, good afternoon, Commission. For the record, I'm Ann Carpenter with the Department of Public Safety and the Chief of the Division of Parole and Probation. So, as the Justice said, during the last Sentencing Commission meeting, we discussed options for releasing inmates, and it was requested that I discuss in more detail the Division's past eligibility date list, or the PED list as we refer it, which is basically just an overdue list. So, what is this overdue list? The Division keeps track of all inmates who have been granted parole by the Parole Board. Once the Parole Board grants parole to these inmates, then the Department of Corrections and Parole and Probation work together to assist these inmates in formulating a release plan. NDOC and PNP are bound by a few statutes. NRS 213.1218, NRS 213.140, and AB 236, Section 100. I don't have that statute. Okay, so I'll discuss those later. But I want to get in, Justice Hardesty asked to get into a granular discussion about our categories. And so the Division uses certain categories to break down the various reasons as to why these inmates have not been released. So I'll go over most of them. The first category, there's 6 of these people, it involves pre-parole plans. So per NRS 213.140, NDOC is responsible for obtaining the inmate's initial pre-parole plan. And so I have to say that PNP and NDOC and the Parole Board, we have collaborated endlessly on this to try to decrease the people in this category. So it fluctuates daily, but as of today, I think there's 6. The second category is for sex offenders that had their primary plan denied due to release limitations by the Adam Walsh Law, and there are 4 people today in this category. The limitations are basically proximity where children congregate, proximity to schools, parks, and other areas frequented by children, making finding suitable private residences very challenging for this segment of the prison population. There are also few structured programs or motels that will accept sex offenders. The third category, which has 40 people, and it involves interstate compact cases. Currently, these cases represent inmates that are awaiting an interstate compact investigation to be conducted by another state. And there are cases that are approved by another state, but the transfer is pending due to the states imposing moratoriums on their transfers because of COVID-19. The fourth category, there's 64 people in this category, and it includes all non-sex offender plans that have been denied. So sometimes plans are denied because there's not the inmate didn't provide a correct address, the address doesn't exist, the phone lines are disconnected, or there's just no viable housing. Fifth category, there's 13, and these people are pending extradition cases. PNP staff work with applicable agencies to coordinate extraditions, and sometimes these agencies are just slow to respond to our requests. The sixth category, there's 5, and their inmates in this category are typically at the parole board having their special conditions reviewed for suitability. And for example, the cases that we had currently are inmates who were ordered onto house arrest, and they are claiming to be indigent and without support or means to pay for the house arrest program, so it won't work for them. Seventh category, or 29 people in this category today, includes inmates that have exhausted all private residence and Medicaid-funded housing options and or have been approved for a program. And when I say program, it's a halfway house, a transitional living facility, or an inmate inpatient program. Eighth category, there's 24 people in this category. It includes inmates who have paid for or been accepted into a Medicaid-funded housing program and are awaiting bed space. Ninth category, there's 30 people in this category, and it includes inmates that wish to expire and are actively refusing parole. Now, this is NRS 213.1218, and it basically says that a person in prison has to sign some documentation. If they don't sign the documentation, they won't be released. And we think that they don't want to be under supervision, under the division supervision, so they don't want to sign it. 10th category, there's 50 people, involves lack of housing options. And so the division has a program called an indigent funding program, and we've exhausted all of that funding. And there's limited numbers of vendors willing to accept inmates, many programs, any housing option that besides a private residence or hotel or motel, such as a halfway house, they're not reviewing applications in a timely manner because of COVID right now. 11th category, 58 people, includes cases that the division is actively investigating. The division has been expediting investigations. It has been closely monitoring the reasons why pre-parole investigations are denied. So we've been really trying to ensure that these investigations are completed and completed timely. 12th category, with 22 people, includes inmates that have approved plans but are still awaiting release. Some examples. The division's awaiting a scheduled bed date for a program or a motel to become available. Sometimes an inmate could be on their first or second or third parole plan before it's finally approved. NDOC transports these individuals, and sometimes that can be difficult if somebody, inmate is in a camp or they're with the fire work area, or just from north to south or south to north. These are challenges that we face. The good news is that AB 236 and Section 100 will assist in this category. The Parole Board and NDOC have been collaborating to ensure that inmates are seen sooner. And the statute says 6 months prior to their parole eligibility. 13th category, there's 12 people, includes inmates who have incurred a new infraction while they're incarcerated, which could include new felony charges that could be levied upon them. And the last category, there's 34 people, includes inmates that have exhausted all housing options or are without private sponsorship or some kind of family support. They've been denied or do not qualify for the few Medicaid paid housing options. They expire too soon to receive our indigent funding, or they lack available identifications required by most programs. It says Sometimes these are sex offenders. Sometimes these are people that don't have citizenship and they can't get their identification. Some of these inmates have been given a release option to a homeless shelter, but they either refused or they were denied because of the risk factors, and they didn't want to be in the. We didn't think it would behoove us to give them to a homeless shelter. Okay, so what are the challenges that PMP faces, and how has COVID impacted us? Well, funding is a huge challenge. So halfway houses, transitional living facilities, they secure payment through either the inmate or the inmate sponsor and the division's indigent funding program or Medicaid. And like I said before, the division's indigent funding program has been exhausted, so we do not have any more money to assist this population. The second is limited parole and probation embedded staff in the prisons. So when we're fully staffed, we're good, and the employees are busy. However, because of COVID, we have 2 employees that are in quarantine. We have 1 employee that's home because of underlying health conditions, and because we don't want staff exposure, we've curtailed any face-to-face meetings, and so it's impacted the way we do business. As we discussed, interstate compact investigations are impacted because some states have placed a moratorium on accepting cases or investigating cases. And motels, hotels, and program challenges. Vendors are reluctant to mix populations because of COVID, so that's an issue. And lack of overall bed space availability due to people not moving out. So there's no eviction process at the moment because of COVID, so there's just the beds aren't becoming available like they usually are. So what can we do? Some proposed solutions. Statutory language. So those statutes that are out there, one proposed solution would be to relax the current the statutes, or maybe see if we could go forward in an attempt to change existing statutory language in the upcoming session. Housing is a huge issue, as we've discussed, so that could be a possible solution. Maybe having some kind of state-owned or state-run housing facility, maybe like Casa Grande, where inmates who are indigent or sex offenders could automatically parole to this type of environment, and there wouldn't be this back and forth of trying to find a viable plan. The challenge with that is who would pay for this and who would operate this type of facility. That's a great question, but I just want to throw it out to the group that maybe this could be an option. And parole and probation, we have our role and responsibilities as outlined in statute. Unfortunately, we don't have the skill set or the resources or the authority to run a housing facility. So even it's a top challenge. I think if NDOC and parole and probation could work together with this session, maybe we could get something on. The third possible solution that I thought would be helpful is some kind of community resource center. And I've been thinking about this for a long time. Maybe some kind of center in the north, in the south, and in the rurals that everyone can utilize, whether it's the city, it's the county, it's the state, it's the courts, it's law enforcement, it's the public defenders, the district attorneys, having like a one-stop shop for everyone to go, and they can get counseling, food, employment, identification, housing solutions. They can possibly get signed up for Medicaid. So I'm thinking that if the state gets together and tries to pull all of our resources together, maybe something like that would be helpful. And so that concludes my presentation.
Thank you, Chief, and appreciate the summary as well as the suggestions you've offered. I did have one question before I open it up to other commissioners. Of the numerous categories that you broke down, other than perhaps the category in which the inmate is refusing to sign the papers for release under 213.1218, are there any of these categories in which you feel the Pardons Board could play a role in addressing the resolution of an inmate's parole grant and facilitating that release?
Usually the Pardons Board, as you know, they would commute somebody's sentence. So I guess they could commute their sentence so they wouldn't be on parole. But that may be a cumbersome process. It might be easier just to simply release them since they've already been granted parole if we relax the statutes. And I don't know if that's possible. But I guess to answer your question, yes, they could. But I think the Pardons Board it'd be more beneficial for them to see inmates who have not been granted parole.
Okay, thank you. I do think there is a portion of the Pardons Board authority to relax the statutes as you have characterized it. You agree with that?
Okay, yes. Okay, great.
That's what I had in mind.
Oh, yes. Then if that's it, let's go for it. Absolutely. Mm-hmm.
Well, I'm not suggesting anybody's going to go for anything or even inviting that, but I wanted to address that the question of that role of the Pardons Board and its ability to address some of these, not all of them, but some of them if they chose to.
Great. Just to weigh the effects of that, if people are released without viable plans, like we've talked about extensively last meeting and this meeting, there will be consequences. If there's no viable plan, sure, then people may not do well.
Well, and to underscore the point, many of these folks are in this position, with the exception of the 30 who don't want to sign, are in this situation because their plans, generally speaking, are not viable. I mean, the extradition cases, that's a different thing, and the cases in which you're waiting for indigent defense but have no funding. I mean, not defense, but indigent resources and have no funding. There's just an awful lot of folks here who are without solutions, given the current economic and housing environment.
Correct.
Yeah. Okay, great. Thank you. And then are there any questions for Chief Carpenter and her comments and presentation?
Yes, Chair Hardesty, Todd Story with the ACLU for the record. I have my first question is about the total population that you've identified here, Chief Carpenter, and how many of those individuals were in this status prior to the onset of COVID-19? So looking at that from the population prior to, say, February of this year until now. And then the second part of my question has to do with housing options, because we released a report about this very situation back in 2015, and the number of people who were approved and available for parole but were being detained for a myriad of different reasons, as you've outlined here. One of those specific reasons that came to our attention back in 2015 is that for those vendors who were offering housing options, there were no non-religious housing options available. So if someone is non-religious, the only option they had was to go to a religious-based facility. Has that been changed since then, and is that available? I realize you may not have the answer right away, but if you could get back to us if you don't have the answer to that currently.
Okay, the first part of your question was the total population prior to COVID and now. I don't have that, but it fluctuates daily. It could be anywhere from 350 to 398. It goes back and forth, but I haven't seen a huge jump in this list because of COVID. It's been rather high consistently, but I can get you the numbers. That's no problem. The second, with the housing options, I don't know about the religious versus non-religious, and I can try to get you some information about that. But I think it's important to note that any housing that option that the division allows parolees to utilize must comply with the state and county and city fire codes and licensing and all of that. So that is a very cumbersome process. It's a very expensive process. And so that's another avenue that we should probably look into. I'm not saying that they should be wound back, and we shouldn't comply with that. It's just that it's a difficult process for people. So that's one of the reasons why there are housing opportunities out there, but parole and probation cannot use them because of that if they're not licensed by the state.
Is that a statutory limitation
Yes.
that you're saying should be revised? Okay.
Yes.
So yeah, and if you can get back to me on the question about a non-religious based housing option, because for those who are eligible and should be released, if the only option available to them is to go to a religion-based housing option, that we've got to figure out some other option for those folks. Thank you.
Any other questions for Chief Carpenter?
Kimberly Mulf for the record. I know from my brother's experience, he's in Texas on probation, but he's having to pay hundreds of dollars a month in probation fees and parole fees. In the current environment, is there any reprieve or halt or anything for individuals that are unemployed or having, all these other things that are happening to them financially? Or are they still in Nevada being required to pay all these fees and at the moment?
So to answer the question, the fees, the Division of Parole and Probation doesn't have the authority to waive those fees permanently. We do have the authority to say, hey, if you can't pay, okay, we understand that. You're not going to go to jail or something like that. It's not an infraction per se. That would be up to the sentencing judge to do that. But to elaborate on that, we couldn't waive some of those fees, especially if it's restitution. The victims need restitution. We couldn't do that. And with supervision fees, that goes directly into our budget. So that's interesting. So they don't get in trouble for non-payment, but we don't have the authority to do that.
Okay, but no one's going to be in violation or get rearrested because you're not able to pay these fees. Okay.
No.
While we're on that topic, just for the benefit of the commission members who may not know, Chief Carpenter, what percentage of your budget is funded through supervision fees paid by inmates under supervision?
That's a great question. I'll have to find out.
Any other questions for Chief Carpenter?
I have one, Justice Hardesty. This is
okay. Go ahead, Mr. Hicks.
Thank you. What type of budget drawbacks are being suggested to you at this point? Like how much of cuts are you going to be looking at having to make?
All state agencies had to make a 6% cut, and then a 10% cut, and then a 14% cut. So I believe the division's budget's around $135 million for 2 years. So
is that so you have to make a total of a 30% cut?
No, just they wanted to look at what it would look like at a 6%, and then an extra 4, which was 10%, and then the 14%.
Okay. So I was looking at these, what was provided by CJI about what some other states have done. And I looked at similar populations just to kind of get a feel for context. Arkansas, for example, has a very similar population in Nevada, about 3 million people. And their governor, according to CJI, recently announced plans for a compassionate release program. To be eligible, it would be a nonviolent offender or a non-sex offender and within 6 months of release. So similar to what the SAFER plan is suggesting, but actually more confined than what the SAFER plan says. And what that did is it made 1,700 inmates eligible for parole board review. What I'm curious is imagine those kind of numbers all of a sudden being eligible for parole on top of the 398 on the PED list already. What would that look like for your division presently, and then your division with 14% less employees?
Those are great questions too. If we had many inmates being released onto parole, well, let me back up. So first, it would depend if they had to be granted parole and go through the parole board process and that sort of thing. And Chairman Dorico could answer those questions. But if they were released or granted parole, let's say, then that would be, X amount of people that our few staff would have to try to find viable plans. That would be very, very difficult, as I've outlined. But then let's just say they were released, they wouldn't have employment opportunities and housing and all of those things. And our staff, it would be very difficult for our staff to supervise them. I've already had our staff look into different ways of supervising people, especially the lower risk individuals, to try to utilize our people, our resources in the best way possible. We would have to do what we have to do. However, I think the state has to understand that with less resources is less supervision. And that's unfortunate. Did that answer your questions?
It does. I guess my only follow-up question is, why is that unfortunate?
It would be unfortunate if, what I mean by unfortunate is that if a lot of people were released to the street and parole and probation had to supervise them, we probably are not equipped with the resources that we need to do the job, or at least do it well.
Okay, thank you. Any further questions for Chief Carpenter? All right, hearing none. Chairman Dorico, was there anything you wanted to supplement from your comments? And has anything changed in the status of parole considerations and the acceleration of parole considerations that you've been involved in?
Thank you, Justice. Chris Dorico with the Parole Board. So I think what you're referring to is our submitted emergency declaration that we had submitted on March 26th.
Correct.
And I can tell you that last week on April the 22nd, heard back from Governor's Office General Counsel that the consideration was there and was being reviewed by the policy team, and since that point in time have had no further updates with regard to that.
Okay.
And that's the only update that I have.
All right. Are there any questions for Chairman Dorico while he's available, or from commission members? Okay, so let me pose a couple of questions to the commission. First and foremost, in light of on this record, does anyone wish to make any recommendations for consideration by the Sentencing Commission to recommend to the governor and to the Division of or the Department of Corrections concerning their strategies and approaches to protect the inmates and their staff from the COVID-19 issues?
Justice Harsey, this is John Arascata. Are we also considering the SAFER plan in this part of the potential motions?
That's exactly what I'm referring to. I mean, in light of the record that's been made in front of the commission, are there any provisions in the SAFER plan that a commissioner wants this commission to address over and above what the Department of Corrections has already represented to this commission they are doing?
This is Christine Jones-Brady. I do have a question, Chairman Hardesty.
Mm-hmm.
Or I'm sorry, was Mr. Arascata still?
wasn't finished with his comments, and we'll get right back to you.
I'll defer to Ms. Brady and then let her ask her questions.
All right, Ms. Brady, go ahead.
Sorry about that. Thank you, Mr. Arascata. No, what I had was a question regarding the CARES Act funding and whether or not that is able to be applied for these releases or in combination with the plan, the safer plan, and how that would work funding wise, because it seems as though that's my question. I'll leave it at that.
Okay, Director, do you or your staff have any information about any federal CARES Act funding for states yet?
Is Director Daniels for the record, sir? Was that question for me?
Yes, sir. And I'll repeat it if you like.
Yes, sir, if you don't mind.
So Ms. Brady poses the question, and I'm rephrasing it a little bit. Is there any CARES Act or federal funding that's been approved in the stages of funding because of the COVID-19 crisis for state budgets or state correctional institutions?
This is Director Daniels for the record. Sir, I'm not aware.
Director Gonzalez?
This is Victoria Gonzalez for the record. As far as I know, the last I heard is that the governor's finance office is the one who's spearheading any of those requests that are for the federal funding that's related to in response to the crisis. And then I think that would then go through the IFC process as well. That's the last I heard. And my understanding is agencies would be going through GFO and they're spearheading that. I'm not sure about the particulars of it, but that would be the place to start to find out exactly how those requests are being handled. And if you are going to submit one, it would start with GFO.
Chief Carpenter, have you received any information about any potential federal funding for supervision agencies?
There are a few grant possibilities that OCJA has been discussing with our department, our division, and at our department. So there are, but again, with a grant opportunity comes some struggles. You know, if we, besides putting in for it and then maybe getting the grant, then it still has to be approved, et cetera, et cetera. So the challenges are still there.
I may be mistaken, but I didn't think that the federal government, or Congress, I should say, had authorized any, we'll call it CARE Act funding for state governments yet, just direct appropriations.
Oh, maybe I'm mistaken. There's two grants that we were dealing with yesterday, but maybe I'm mistaken. I'm sorry.
Yeah, I think Ms. Brady's question is under the CARE Acts, and the CARE Acts have been like the Paycheck Protection Program or the distribution of funds for individual family members, those kinds of things. I think that is the debate currently in Congress, where states are seeking federal funds to supplement their budgets, but I don't think that that's been acted upon yet. Now, maybe I have mischaracterized your question, Ms. Brady. Did you have did I misunderstand or misapprehend your question?
No, that was good. But if there is other funding too, I said the CARES Act because that's kind of been on my radar. But if there's other funding, federal funding out there that can help us and help at least build some kind of an infrastructure with housing, or, beef up our reentry, abilities, and, identifying from the stats that they gave, it sounds like there are quite a number of people where their only impediment in being released is that there's a lack of housing or support. So I just was throwing the CARES Act out there, but if there's other funding too, that would potentially be hopeful.
Well, Dr. Salisbury mentioned earlier access to, and I think that was grant money, correct, Doctor?
Yeah, I'm just looking at, this is Emily Salisbury for the record. I'm just looking at the solicitation now, and I did send it to Director Gonzalez just so that she has it and can distribute it to the commission members and to anybody else. may want it. But I do believe it is a grant that the deadline is May 29th, 2020. I haven't looked at the stipulations. So with regard to Chief Carpenter's comment and the complexities of going after grant money, they may have relaxed some of that. I don't know, but I'd be happy to look into it further. But yes, the Federal Department of Justice, through the Bureau of Justice Assistance, has coronavirus emergency supplemental funding in the amount of $850 million for public safety agencies. And I'd encourage certainly the Department of Sentencing Policy to consider applying for it too, given that they're staffed at 50%. So, yeah.
Okay, thank you. Mr. Arascata, we'll circle back to you, and then I'll repeat my question. Are there any provisions more specifically, are there any provisions in the SAFE plan that this commission would like to recommend to the director or to the governor that are not already being undertaken or addressed by the Department of Corrections? Mr. Arascata.
Yes, I have a motion, and it's a little bit broader than how you phrased everything, but
go ahead.
Motion would be the following, that we as a commission submit a letter to the governor and to the pardons board urging a relaxing of the statutes within its authority to conduct responsible depopulation of the prison system, utilizing a framework of at-risk people pursuant to the CDC guidelines and the SAFER Plan principles.
I will second that. Todd Story for the record.
Okay, Mr. Story has seconded the motion. I want to make sure that Steph has that motion. Mr. Arascata, would you repeat it, please?
I'll do my best. A letter to the governor and the pardons board urging them to relax the statutes within their authority to conduct responsible depopulation of the prison system, utilizing a framework of consideration of at-risk individuals pursuant to the CDC guidelines and the principles of the SAFER Plan.
Okay. Any discussion on the motion?
Chuck Calloway here. I have a question.
Yes, sir.
So thanks, Mr. Chair. So last meeting, we had a pretty divided vote to recommend that the Pardons Board convene early to review potential release of certain inmates in NDOC, and now we're taking a motion to basically compel the governor or the Pardons Board to look at a process that's outlined in this SAFER document, which we've been given. My question, I guess, is this: the director, over 2 meetings, has provided us great detail on what he's been doing within the Nevada Department of Corrections to mitigate this virus, to ensure the safety of inmates, to ensure the safety of his staff and the public. He has provided us, he's answered numerous questions and has had his medical staff available to answer questions. He's invited folks to come tour and partake in a town hall at his facilities. So I guess my question is this. My understanding is that the governor, through executive order, already has the authority to implement a depopulation based on whatever criteria he sees fit, whether it's the SAFE plan or whether it's some other plan. And if the director, in his expertise running that facility, believes that he's reached a critical stage where lives of inmates and staff are in grave danger because of the current population, doesn't the director currently have the authority to reach out to the governor and request the governor take action? I guess, as a member of this commission, the director is part of this commission, I just don't understand, or maybe asking for clarification, the need for this body to collectively urge the governor to take some type of action when the director already has the authority, I believe, to urge the governor to take that action if he sees it appropriate.
Chair Escada.
I'm not sure if that's a question or a comment upon the motion. The motion's been made and seconded. Do we move forward?
Okay. Chuck, is there a question you wanted to ask of someone in particular? I don't know that the question, I don't know if it's a statement or a question that you have.
Okay, Justice Hartsey, I guess I'll try to simplify this. I guess my question would be, number one, doesn't the director currently have the authority to ask the governor to, through executive order, depopulate the jail in a manner that the governor and he believe to be appropriate, whether it's the safer plan or some other plan? I guess that's my question. And then second, if so, why do we need this motion?
Well, with respect to your first question, I'm not offering a legal opinion and I can't. I would just observe that the extent of the governor's authority, the director has the authority to ask whatever he wants of the governor, I think. But the question then is what authority does the governor have to depopulate the prison without involvement of the Pardons Board? I don't know the answer to that. I'm just posing that as a question myself. And it is an issue, I think, that is out there. Don't know the answer to it. The question is whether or not, as I understand the motion, it's necessary for this commission to recommend that the governor undertake that action and under those standards. And I think commissioners can decide for themselves whether or not that is wise or unwise. But I do think that there is a fundamental question about the extent of the governor's authority, and because that issue is implicated in a pending case, I'll be abstaining on this whole process anyway, or on this whole motion anyway. I have to. Are there any other comments with respect to this issue or this motion?
Kimberly Moll for the record. It's a half comment, half question. So we had a presentation earlier about the other 49 states and what they've been doing, and there were several things in there that were not specifically in the SAFER plan. And so are we just on this motion, we're just putting up the SAFER plan and not these other lists of things we've seen, such as no early release of sex offenders or domestic violence offenders, or making sure that, okay, that's part number one. Number two is, are we also going to recommend and have some kind of assurance that there's going to be social services available for the people that are released early? We've heard from probation, they're very limited access for people they already have on their list. And I know that, like, in our current domestic violence shelters and things to that extent, we are overwhelmed at the moment across the state with the amount of people that need help and the limited ability to help them. And so I just want to make sure that the second part of that is, we also recommend, if we're going to release these people, that we also have resources and things in place to help them and make sure that they're not put in a position to either reoffend or to go in, what we call survival mode, where, you do things normally you may not do, but you're trying to survive because there's limited housing, food, and employment.
Chair Escada, can you respond to Ms. Mull's question, or do you can, or if you choose or not?
Sure. That's why I called it responsible depopulation. We're a recommending board. We can make a recommendation to the pardons board and the governor to consider responsible depopulation of the prison, and then utilizing the framework, as I said, of the CDC guidelines and the safer plan principles. Her question, I think, is answered in calling it responsible depopulation.
Any other comments on the motion?
This is Emily Salisbury for the record. So just in reference to Chuck Calloway's questions, based off of a media story from the Nevada Independent, Governor Sisolak has publicly acknowledged that he's waiting for the recommendations from the Sentencing Commission. Quote, they've given me no definition thus far. I've got no recommendation from the Sentencing Commission. He said, I'd like to know what their recommendations are because they're there for a reason. So if we can trust that that is accurate, it seems like in order to move forward, we need to provide some recommendations, and I'll leave it at that.
Any other
this is Chuck Calloway again, and I really appreciate what was just said. And if the governor, I didn't see that article, but if the governor has made that statement publicly, then certainly we want to give the governor the tools that he needs. But I also want to make sure that the director has that we're supporting the director, and he has the tools he needs and what he feels is best for his facility, which he's in charge of running. I guess maybe, and I don't know if it's possible to have a second motion or a change of the motion, but in my mind, I'm just thinking out loud here. I think that a motion along the lines of what was given, however, saying that we encourage the governor to work with Director Daniels on the protocol for the depopulation using the SAFER plan as a potential guide. I think in my mind, I guess what I'm getting at, the two things that are kind of a hard pill for me to swallow is, number one, going basically around the director and saying, this body, okay, director, you've told us all the great things you're doing. You told us all the steps you've taken, all the measures you've taken to make people safe, but yet we're going to go around you and go to the pardons board and say, here's what we want you to do. I think that the second hard pill for me to swallow is just adopting the SAFER plan in and of itself. I mean, I think the vast majority of what's in the SAFER plan is really good. But when I read the SAFER plan, there's references in here where they talk about they consulted with corrections officers. But who were these corrections officers? It doesn't list where they, what agency they worked for. It doesn't list the size of the facility they worked in. It says parole and probation officers, but it doesn't list those individuals that they coordinated with. They start off in their initial summary talking about the United States overall, how many people are incarcerated, which immediately makes me think that folks that were behind this maybe have ulterior motives beside strictly the welfare of people during a pandemic. And then finally, there's comments in here that, in my opinion, at least for our facilities, are completely untrue, that inmates lack hygiene products in jails typically. Where does that come from? I know that in our jail, in CCDC, inmates have total access to hygiene products, whether toothpaste, soap, running water. And, in a minute, when I talk about the steps we've taken in CCDC, we've issued PPE equipment to inmates. The director talked at length about hygiene available to inmates. So, again, I don't know where some of this information in this SAFER plan comes from, but just saying that I want to adopt this plan as the one that the governor should use, I kind of have a hard time with that. I certainly think the director should be able to reach out to the governor and say, hey, it's time to depop my facilities for the safety of everyone, and here's the protocol. Yeah, there's 10 things in this SAFER Act that are great that we should use as a guide. Maybe there's a couple things in here that we don't think are relevant at this particular time, but I think that's my point of view based on the conversation I've heard. And, I know I'm probably the odd man out here, but that's just my perspective.
Chief Justice Hardesty, this is Scott Freeman.
Yes, Judge Freeman.
Thank you. As representing the Chief Judge in the Second District and also the only member of the judiciary that can participate after Judge Hardesty has indicated that he has to abstain. Vice Chief Callaway is not alone. On behalf of the judiciary, we're the ones that put the people in the prison. So as a consequence, I'm opposed to the motion. And during this discussion period, I wanted him to know he's not alone. I feel very strongly under the circumstances that the Director of Prisons in his detailed analysis and answer to our questions was very satisfactory to me. And that under the circumstances, I feel him very much in charge, understands what should occur. And on behalf of the judiciary, we're the ones that put those people in prison. And I'm not interested in letting them out without a reasoned, appropriate approach. And that's my recommendation, is to leave it to the experts like the Director of the Prisons. That's what I'm weighing in at, and that's my opposition to the motion. Thank you.
I have something to say, Justice.
Yes, go ahead, Chief.
Ann Carpenter, for the record. Mr. Arascata, I would like us to define responsible, because I don't really know what that means. Your responsible and my responsible could be different. Number two, Dr. Salisbury talked about recommendations, and so I don't understand exactly what recommendations we're making. I mean, I get the safer plan and that sort of thing, but I don't think they're laid out as well as they could be. Number three, Director Daniels has talked about all the things that NDOC is doing, and if we take people that are outlined by CDC to have all these underlying conditions and we let them out, aren't they safer where they're at? I'm confused with that. And four, I was thinking that if we were going to ever do something like this, wouldn't we look at the crimes that people committed and how long they're on for and that sort of thing, and not because they have an underlying health condition? So those are the four things I wanted to bring up to the group.
Any other comments on the motion?
This is Christine Jones Brady, for the record. Thank you. Are we able to have, did you recognize someone else? I couldn't hear.
No, I didn't. You're recognized for.
Thank you, Your Honor. Are we able to have a working group of the Sentencing Commission that might include people outside the Sentencing Commission? For example, I know that, or it's my understanding that the governor relies on several health officials when making his directives, various directives and so forth. And I'm wondering if we can bring together some of those health officials as well as some of us on the Sentencing Commission and NDOC and PMP to meet with them and come up with some recommendations for the governor, some more like specific guidelines as to, as Mr. Arascata said, responsible release.
Well, that is an option, I suppose, if the commission is interested in pursuing that. But at the moment, the issue on the table is the motion that's been framed.
Yeah, Justice Hardesty, this is John Arascata. I believe there's Vice Chairman Callaway made a motion to modify the motion I made to incorporate that where I talk about the Pardons Board and relax under its authority, that also the governor and the Director of Prisons hold meaningful discussion regarding responsible depopulation. I'm willing to accept that modification to my motion.
Well, we get into Robert's rules, so let's back up. Is the second to your motion, Mr. Story, willing to accept that modification?
Yes.
So then I think it is necessary, Mr. Arascata, to restate the motion as with that modification, and then we'll proceed with the discussion.
Okay. That we ask the Pardons Board, Governor, and the Pardons Board and Governor to relax the statutes within their authority regarding responsible depopulation of our prison that includes meaningful discussion between the governor and the director, and that they utilize the framework under the CDC guidelines and also the principles of the SAFER plan.
Mr. Story, does that, do you still second that motion?
I do, yes.
All right. Are there any, is there any discussion on the revised motion?
Kimberly Mull for the record. Sorry.
I'm sorry, Dr. Neighbor, were you going to comment?
Well, yes, I just had a question. If this motion goes forward, would the commission then get a plan back with specificity to consider about what the actual proposal going forward or the decisions about that depopulation were going, how they were going to happen? Would we get then the plan to review, or how would this proceed?
Chair Escada. Mr. Escada, can you answer that question?
Justice Arsty, Chuck Calloway, maybe I can answer the question. The way I
I'm sorry.
envision it is that...
I'm sorry. I was muted. I apologize. Okay. I was trying to talk. What I was saying was that we're a recommending board, and this is a recommendation to the Pardons Board, the governor, and the director, urging them within the framework as stated to then come up with a depopulation plan or process using the CDC guidelines and the SAFER plan as their kind of hallmark principles.
Justice Hardesty, this is Darren Emily. If I could make a comment.
Yes, sir.
If we look at one of the letters that was submitted by the federal public defender, they give more specificity with regard to groups that potentially that the governor could look at. For example, individuals already granted parole but not yet released, vulnerable persons within 18 months of parole eligibility, and it gives a definition for vulnerability. And then for some of those that have made comments about the nonviolent offenders, one of the recommendations is all nonviolent offenders 3 years from parole. If we wanted to include more specificity or more direction for the governor or the Pardons Board, those are some alternatives as well that could be done.
Well, certainly that's something that could be done, but we have a pending motion. Are you wanting to amend the existing motion?
Sorry about that. I'm good with the motion as is, but that would be an alternative if there was more support for an alternative. But I support the motion from Mr. Arascada as proposed.
Okay. Any other comments regarding the pending motion?
Yeah, Justice Hardesty, John Ponder for the record.
Yes, sir. Go ahead, Mr. Ponder.
Okay. I think I stand with Vice Chair Calloway and with the comment that Judge Freeman made, that we should lean towards the director as he being the expert in it, just as Judge Freeman said that he's responsible for putting people there. There are service providers that are in this community, including ours, that are responsible for people who, once they get released, to make sure that we're doing everything we can to help them to be successful. I'd like to know exactly what the responsible depopulation is what that's going to look like. And I'm just going to make the comment to make sure that it's not a irresponsible depopulation, right? I know that there are people that, and again, this is what my bailiwick is. I'm on the ground every single day. You know, the 400 or 500 people that we're working with that have already got out in the prison, listen, they're hurting right now on the streets. They have no jobs, no place to go. We're trying to raise money so that we can, be able to provide for rent for them. So I just want to make sure, number one, I guess the question would be, what does this responsible depopulation look like? And are we being irresponsible and providing the service to some folks that, yes, we want to get them out. We want them to be safe. But is it based on what the director said, right, and the comments that he has made, and some of the things that I've personally seen while I was inside the institution, is it safer for them? And again, this is a question. I'm not making a statement. I'm posing a question. Is it safer for them to be where they are based off of what the expert and Director Daniels had indicated, than as opposed to us, responsibly depopulating the prison?
Is that a question posed to any particular person or to the maker of the motion, or are you just posing it rhetorically?
Right. So what I'd like to do, maybe the maker of the motion or anyone on the, any other of the commissioners, if we could talk about what does that mean with the responsible depopulation, and what does that look like?
Sheriff Scotta, do you want to respond to that?
I do, and I'm going to be a little bit repetitive and redundant here, is that it's being left in the very capable hands of experts in the governor, the pardons board, and the director to conduct responsible depopulation. I think we have to, as the captain of detention here at Washoe County stated, they have no positive tests, but they'd be naive to think that they're going to get off, that it's not going to happen. All it takes is one. We have inmates that are within their cells together 22 hours a day or for lengthy periods of time. It's not a healthy situation. We can see that from other prisons throughout our country, that they're tinderboxes. And if we can depopulate to where there can be meaningful social distancing within the prison, I think it's a win for everybody. And I ask that the motion go forward.
Okay. All right. Any other discussion from commissioners who haven't been heard from on the motion?
Kimberly Moore.
Chair Hardis, it's Brian.
Oh, yes, Mr. Marsh, go ahead.
Yeah, hi. I think I support the motion, and I think the question right now is, do we look at a responsible plan like Mr. Arascata has proposed, or do we do nothing? Right now, we're one of only 17 or so states, and I do very much appreciate that Barbara took all that time and her staff to put that together. And it's really quite a great survey about what type of factors should be taken into account, which are also the factors for the plan. My own experience is on the federal side. Somebody mentioned the CARES Act earlier. There's actually a criminal justice component to that, where the Attorney General and the Bureau of Prisons Director were instructed to go out and identify people who met the criteria for release. It's going to include things like age, health factors, time until release, and underlying conditions. And even that has a backstop, which I'm sure Judge Friedman would appreciate, where if people are denied, they can go to the judge who sentenced them and get out. That's something that doesn't really work under our statutory framework we have in Nevada, something to think about in the future. It actually was based on the First Step Act that was passed a couple of years ago. So what I would propose is I support the motion. I also think we should be looking to the director of NDOC to help with this effort. They actually do what's going on in the federal prisons, where wardens are being asked to actively identify the crime should be released instead of just a blanket, do nothing like we're doing now. And so again, I support the motion. Thank you.
Ms. Mo, you had a comment, and then I'll see if there's any other comment, and then we'll call for the motion.
Yes, sir. First, let me say I am pro criminal justice reform. I am pro depopulating our prisons as a whole. But I feel like using COVID-19 as an excuse to do that, or having not specifically defined definition of responsible makes me nervous and scared, to be honest. The fact that my rapist can get out of jail 6 to 18 months early because he has asthma, when the average length of prison term is only 4 to 5 years to begin with, or that because someone's over 65 and they're a sex offender, they could get out. I've been raped by more men over 65 in my life as a child than I can even comprehend or count. So to think that there's not specifics defined as what's responsible in our recommendation makes me scared. I saw some great things, I feel, in the list of all the 50 states of what some people are doing. I feel like are more specific than just the safer plan. And I think if we could add some specifics or add some type of measure of getting to review what the responsible is, I'd feel safer in that. But as a survivor, I'm very scared with the idea of just leaving that as a blanket statement and not knowing what that specifically is. Thank you.
Okay.
Can I speak? Sorry.
Yes, of course.
Hi,
Go
this
ahead.
is Assemblywoman Rochelle Wynn. I apologize I had to step out. I had a medical appointment, but I am back and I did hear the last part of this. I just want to be clear. The motion that is on the table is just, I wrote it down, so I'm reading here. It's just to make a recommendation to the Pardons Board to consider a responsible plan for release. Is that utilizing SAFER as a guideline? We're not, so and granted, is that correct?
I'll ask Mr. Arascata to respond. I think I'll ask the director. Is that your understanding of the motion?
That the last amendment, the amended motion I have is making a recommendation that includes a recommendation that the Pardons Board, the governor, and the director of NDOC work together to relax the statutes within their authority towards a responsible release and a release plan to depopulate the institutions and have a meaningful discussion utilizing the framework of the SAFER plan and recommendations from the CDC.
Okay. I just want to go on record saying that I do support that motion, and I fully trust the governor, the Pardons Board, and the Nevada Department of Corrections, especially after hearing what they've had to say, about the things and the steps that they've taken. I believe that they are in a position to be able to be best to examine, how we define, how they define responsible, since they do it on a daily basis anyway. So I would hope that they are in a thing. And I'd also point out that, I know that there's a lot of crossover and it's easy, but I feel like we've kind of gone down a wormhole where people are confusing criminal justice reform with dealing with an immediate, fatal, global health pandemic. And I'd just like to bring it back because I think there is some urgency in this, as we can see by the sheer number of deaths, that I think there is a place, and there's probably a place on this commission to discuss like overall criminal justice reform. But I really see this motion as being a starting place to put the people that are professionals that deal with this kind of thing to come up with a responsible plan, or to consider. We're not even telling them to enact one. We're telling them to consider one with, this SAFER plan as a guideline. And they can obviously take from what they see that was presented in other states that is working well, and how they define responsible, how they determine who is eligible. And I think we can look at, some of our local jurisdictions like the Clark County Detention Center. We trusted the sheriff to make those decisions on how to responsibly and safely depopulate pursuant to like that district court order. So I am in support of this. I see this putting the people that have the knowledge in the position to make those specific, considerations for what is responsible. And I trust them based on the presentations that they've made, based on the representations that we have done so far. And I'll just leave it at that. Thank you.
Any other comments before the call of the question?
This is Michael Minev, Medical Director, NDOC, for the record. I just wanted to offer an opinion that if we're looking at our entire population of inmates and looking at chronic conditions as a criteria in terms of those causing immunocompromisation that might cause individuals to be more susceptible to COVID-19, we could be looking at literally hundreds and hundreds of inmates that could be potentially released into our communities, which could very easily overwhelm the state of Nevada's capabilities to provide proper health care to the individuals. You have to remember that in Southern Nevada, we probably have just a couple hundred, even maybe less, ventilators at all of our hospitals in Southern Nevada. The other thing to consider also is that we are likely, this is likely just one spike in this pandemic. There probably will be other spikes in the years to come. There has been the promise of a vaccine in 12 to 18 months. However, the fastest vaccines produced in the past have taken 3 to 4 years. So I think 12 to 18 months is a very optimistic view of the end of this pandemic, and we're likely going to have other spikes. So if we do take this into consideration, we have to take a look at possible spikes of this pandemic in the future, and how will that affect the ability of our state to provide the proper health care to this influx of individuals into our community.
Okay. We'll call the question unless there's another comment.
Justice Hardesty, I still have a comment.
All right, Mr. Hicks, go ahead.
Chris Hicks. I think we need to go back to the very foundation of what we're talking about here. And that is simply, we are contemplating as a commission recommending the release of inmates who are serving lawful sentences. These are inmates that, through their behavior, through the crimes they committed, were deemed dangerous enough or worthy enough of punitive measures that put them in prison. Judges considered these, lawyers argued on both sides, and these were the results of what justice decided. And now we're honestly talking about recommending that the Pardons Board start releasing people that were subject to those sentences, people that left victims in their path, people that have done serious crimes. It's not easy to get in prison nowadays. I can represent, having been a prosecutor for 18 years. Truly, the people that are in our prisons are of the type that we would expect to be in our prisons. The narrative to the contrary is just not accurate. And we're contemplating this in spite of the extraordinary work that Director Daniels has done. Better than I've heard anywhere in the country. And there are no positive tests. So just starting at that baseline should be enough for us all to step away from this motion, but to add on to it. Within the motion is the recommendation of the SAFER plan. The SAFER plan, I have immense concerns with. It is incredibly overbroad. It lacks definition. Assemblywoman Nguyen, talked about how we're kind of conflating the pandemic and criminal justice reform. But when we think about that, we need to look at the organization that this SAFER plan comes from, and that's the Reform Alliance. And I don't know if any of you read their mission statement, but this SAFER plan comes from the Reform Alliance. Their mission statement is, quote, to dramatically reduce the number of people who are unjustly under the control of the criminal justice system. To win, we will leverage our considerable resources to change laws, policies, hearts, and minds. When you go to their About Us webpage, it says, quote, our collective disgust with the current state of the American criminal justice system is creating a powerful, growing alliance that spans different backgrounds, industry, and political beliefs. We won't stop until we've changed the laws, policies, and practices that perpetuate the horrific injustice we're seeing in America. Now, I think we can all agree, we all have different views on this commission, but that's extreme. And that's who this SAFER plan recommendation is coming from. And when you look at it, earlier, I believe it was Mr. Imlay said, you know, we're not talking about violent offenders, we're not talking about the types of releases that would shock the community, but that's just not true. When you read the SAFER plan and they talk about recommended prison releases, they simply recommend releasing persons incarcerated who are within 6 months of release. There is no qualification of what type of crime. There is no qualification of whether or not it was violent or nonviolent. And then they further say, release those persons from incarceration, implementing house arrest, electronic monitoring, or other measures as necessary for the balance of the term of their incarceration. Well, we've already heard from Chief Carpenter. We can't even get the people that have been paroled out and supervised. How are we going to do it with all these people in that vast amount of inmates that fall within that category? You move to their next one. Technical violations. Any person who is incarcerated due to a technical violation. Now, in Nevada, pursuant to AB 236, a technical violation is any violation that is not a felony, a gross misdemeanor, or absconding. So it could be any misdemeanor, it could be a domestic violence, it could be a DUI, it could be drug use. Any of those people, they also should be released to house arrest, electronic monitoring, again, of which the system has no capabilities. And then lastly, they recommend compassionate release. And this is just a overreaching, pulling on your heartstrings kind of recommendation of let's release the elderly who are in there. Well, you know, you often hear the age of 60 or 65 is that qualifying as elderly. I know a lot of people who are 60 who don't consider themselves to be remotely elderly. And I also know a lot of defendants that we've put away over the last 5 years that have done some very serious crimes that were over 60 years of age. And so the SAFER plan would result in, if followed, would result in such a massive release of our inmates, despite the fact that we have no outbreak in our prisons, that it would overwhelm our Division of Parole and Probation, who's already facing cuts. It would, and I believe this. I'm a prosecutor, so I'm usually arguing the prosecutor side of things, but I am a firm believer in reentry programs. I genuinely want to see people succeed. And I can't tell you the respect I have for what Mr. Ponder is saying. That's his industry. And he himself is saying we should not be releasing these people without finer constraints. They have nothing out there for them. It would be uncompassionate to just release all these inmates without a proper plan, without proper resources. It's not safe for them, and it's not safe for our community. That's the one thing that is not being talked about. What about the safety of our public? And we're releasing inmates into the community. Now, the one last thing I want to say about inmates. According to Director Daniels and the medical director, there are 12,000 plus inmates. There are no positive tests. If you look at the population of Nevada and divide that by the positive tests in Nevada, that's about 1 out of every 640 people get COVID-19. That's just general population. That's not even considering at risk like homeless or vulnerable drug users or substance abuse users. In the prison, we're 0 for 12,000. So I have a hard time believing that they're going to be safer when they're released. And I feel strongly about that in the fact that there's no housing, no jobs, no resources. We can't even release the 398 people that have already been granted parole. So I appreciate everybody's comments, but I think that this motion is incredibly premature. There is no reason to recommend any kind of release of these lawful sentences that are being served. I'm a strong no against this motion and encourage others to be so as well. Thank you.
Anybody else who has not had a chance to comment?
This is Director Daniels.
Yes, Director Daniels.
I've given this great thought. I feel compelled to share my thoughts regarding criteria I would use in identifying inmates for early release consideration. However, please understand my statements have not been vetted through the executive branch policy or legal staff. So this is all Director Daniels. Release of inmates is not a trivial matter. Public safety is paramount and must be taken into consideration with every decision and recommendation. What are we releasing inmates to? We still have not addressed core survival issues an offender will encounter when released. Let me repeat them. Lack of jobs, no source of income, no housing or shelter, limited to no health care, and special consideration regarding the release of sex offenders. Someone tell me where their sex offenders will go? I don't know if they'll be on the final list. However, when we're looking at the vagaries of what's been stated so far, for instance, responsible depopulation. What is vulnerable? What is a compromised immuno disease? If you could just qualify on those general terms, I know my inmate population. That'll be the vast majority of my inmates, but I'm still a citizen of the state of Nevada. And I still believe in what is good and right about protecting the citizens. And although there is a motion, this motion is too general. I would be more than happy to participate in a group at a moment's notice in helping to define what some of these terms are. But I would be remiss if I stood idly by and allowed this to move forward through either abstention or not offering an opinion at all. I am 100% on helping define. I get it, I understand it. But as previously stated, this is serious. Those are my comments. Thank you.
Okay, thank you. Any other comments? All right, we'll call the motion and take the roll.
Mr. Arascata,
Yes.
Chief Carpenter,
No.
Director Daniels,
No.
Chairman DeRico,
No.
Judge Freeman,
No.
Mr. Hicks,
No.
Mr. Imlay,
Yes.
Ms. Brady,
I have to recuse myself due to pending litigation.
Sheriff Logan,
No.
Mr. Marsh,
Yes.
Mr. McCormick,
Yes.
Ms. Mull,
No.
Dr. Neighbors,
No.
Mr. Ponder,
No.
Dr. Salisbury,
Yes.
Mr. Story,
Yes.
Ms. Assemblywoman Wynn,
Yes.
Vice Chair Callaway,
No.
and Chair Hardesty is abstaining.
As previously announced, I'm abstaining because of the pending, actually more than one pending case in front of the Supreme Court related to this subject.
There's 7 yes and 10 no's. The motion does not pass.
Okay. Are there any other motions or discussions on this agenda item that the commission would like to make?
Justice Hardesty, this is Darren Emily. I would make a motion that a letter be sent to the governor that would include a definition as far as categories that the governor should consider, including individuals granted parole but not yet released, vulnerable persons within 18 months of parole eligibility, with vulnerable being defined as a definition set out by the Center of Disease Control, the World Health Organization, including older adults, people of all ages with various underlying medical conditions. And lastly, all nonviolent offenders 3 years from parole who have demonstrated equivalent of an approved parole plan. That would be my motion.
Is there a second to the motion?
Second.
Chair Escada seconds the motion. Any discussion on the motion?
This is Christine Jones-Brady for the record. So the motion is a little similar to what I think I've asked a couple times, and I don't know when he got to his motion before I could say anything, but are we allowed to have a working group where we could really detail these things? I mean, the letter assumes we've already gotten together and we figured it out, but shouldn't we get a working group to put together some really detailed recommendations? So that's my question.
If the commission wants to entertain a subcommittee of this commission, you can certainly consider that. I don't think the statute allows for that, is my memory. The chair, I think, is permitted to appoint subcommittees that might include non-members of the committee, but that was under, I think, under the ACAJ statute, not under this statute. So I think the answer is no, at least from my memory, Ms. Brady.
Thank you, Your Honor.
Any other question, or excuse me, any other discussion on the motion?
Chair Hardesty, Todd Story for the record.
Yes, Mr.
I have a question of Director Daniels. How long or how quickly could he compile a list based on those criteria and get that to us at the Sentencing Commission and additionally the Parole Board and the Governor's Office?
This is Director Daniels for the record. As stated previously, I would work feverishly with a group of individuals to define some of this criteria. Tomorrow's not a good time because I have to testify before another committee. However, I'm deeply committed to this topic, and I want to not only be heard, but help guide and help understand. So I would tell you as soon as possible, beyond tomorrow. Obviously, though, I can only speak for my schedule and time, but I would certainly make this a priority.
Thank you.
Any other discussions on this motion?
Christine Jones-Brady again for the record.
Mm-hmm.
When does the ACAJ next convene?
Ms. Nguyen, you're the chairperson of that commission. I'm not sure that there is another date that's been scheduled.
We do have another date. The next date for the ACAJ is June 11th. But I do have the ability to, in the interim between meetings, to convey sub-working groups. So I'm actually emailing as we were typing, as you had brought that up, about having a subcommittee. So we do have the ability to address that.
Mr. Chair, Chuck Calloway.
Yes, sir, Vice Chair.
Just a very fast question. I know we're beating a dead horse here, but to Director Daniels. If, sir, you felt that things in your facilities were getting to a point where depopulation was necessary to save lives and to reduce spread of the pandemic. I'm assuming that you and your staff would have a protocol for approaching the governor's office, meeting with the governor's staff, his general counsel, to sit down and identify, based on all of the plans that we've seen. When I look at the list that CJI gave us, multiple states have executive order, executive order, executive order. New Jersey, Washington, and Philadelphia, I think, executive order. So you have the ability currently to approach the governor and say, sir, we need to depop my facilities. Here's my recommendation, and take those steps yourself, just like the sheriff did here in Clark County when he realized that we were seeing cases inside CCDC and we needed to take steps. Is that correct?
That is not an assumption. That is accurate. I would certainly have the ability to approach the Chief Executive Officer and make recommendations based on my experience and knowledge and current circumstances.
Thank you. And I personally feel there would be nobody that would know when that time was better than you yourself, sir. So that ends my comment and question. Thank you.
Any other comments on the motion?
I have a question for Director Gonzalez. This is Chris Hicks. Could you read that motion again, please?
And then please correct me if whatever I miss, Mr. Emily. So the motion before the commission at this point is to send a letter to the governor and to consider a definition of categories of individuals to release. Those categories would include those who have been granted parole but not released, those who are vulnerable, and based on the way that using the way that the CDC defined this term to include older individuals and those with underlying conditions. The categories would also include those offenders who are nonviolent and who have an approved plan for reentry or release.
Thank you. Yeah, just quick comments. I'll rest on what I've already said on the last motion, but I do just want to highlight again this is the seriousness of trying to overturn just decisions that have already been made, despite any active threat actually existing in the prisons. A couple points to be made based on this particular motion. Older individuals, according to the CDC, again, as I mentioned before, those individuals commit very serious crimes. I have a list in front of me that was given to me by the director of my Child Advocacy Center of recent defendants who have been convicted of very serious sexual assault abuses on children. And of the 8 she gave me, they're all over 60 or 65, serving massive sentences, and I'm sure they would qualify under the CDC. And those should not ever be the type of people, facing COVID or not, that we should be talking about releasing. The mention of nonviolent offenses. Nonviolent offense is difficult to define. If we just throw out nonviolent defendants, well, what is a nonviolent defendant? If we look at NRS statute, the definition of violent crimes excludes, not included, child abuse, child neglect, child abuse causing substantial bodily harm, elder abuse, arson, residential burglary, home invasion, DUI causing substantial bodily harm or death. Those would not qualify as violent crimes and would be subject, according to this motion, to consideration of release. Again, and another one, animal torture, of which there's defendants in prison for that, that would be considered potentially for release when those are clearly violent crimes. Those are very, very much so the types of crimes that the public expects to be in prison. So again, I'm a strong no on this. I still believe it's premature. I think Director Daniels is doing a great job, and as he just said, he would never hesitate a second to go to the governor if he felt there was a need. And we've seen his actions; they speak volumes. I know he will do exactly what he says he would do. And then again, we cannot escape the harsh reality that there is nowhere for these people to go, no jobs for them to find, no resources for them to get. It's actually contradictory to AB 236, in my opinion, what we're talking about doing, because we're talking about casting people out into the stream without any type of life-saving device. We're just saying go for it, and that is not going to work. We all know that. We've heard enough in the Sentencing Commission, and frankly, it will result in more victimizations and failure by those defendants. It's just not right at this time. We don't need to recommend it. The governor can do it if he wants. Thank you.
Any other comments by commission members?
This is Emily Salisbury. Thank you. Again, as a criminologist, I have to just sort of be in shock about some of the assumptions that are being